Hello, everybody. This is Holly Stokes with the Brain Trainer, and I'm here today with Sherrie Davis. Dr. Sherrie Davis is a naturopathic doctor, specializes in nutritional kinesiology, clinical hypnotherapy, and NLP, and has built a practice in Camas, Washington. And I'm just really excited about hearing your background. I've actually known Dr. Sherrie here for years. And I was kind of surprised to find out all of your official titles over the years. So I think it's really fascinating to hear the story of what brought you into the field of hypnosis. Would you mind sharing some of your path?
Yeah, so when I really started in kind of the holistic fields, I guess, of therapies, I was 36 years old and I ended up having uterine cancer, and I started seeking out naturopathic care. And at that time in my life, really sought out every avenue of naturopathy, whether it was hypnotherapy to naturopathic treatments, to all kinds of different modalities that were just more natural. And hypnotherapy was one of those treatments. And I thought, well, is there an emotional thing that's attached to this cancer? And so, and as I discovered that through kinesiology, to doing the NLP, the hypnosis, doing all kinds of naturopathic treatments, I've discovered that, yeah, there was an emotional piece that was attached to, a part of the cancer and how it was reacting in my body, basically, and why it was there in the first place. And, and at such a young age. And then I've had cancer 2 more times after that. And so, and we can look at it too, because part of it can be genetic, but there's parts of it that can be, emotional. And
Yeah.
so, but the journey really was to kind of discover not only in myself what I could do to improve my own health, but how not only did it help me at such a great deal as a personal experience with it, that it also could help others. And so that's why I decided, I'm going to go back to school and I'm going to, get a naturopathic degree in nutritional kinesiology and natural medicine, and then taking further studies in clinical hypnotherapy, NLP, and emotional code release therapy, and just discovering all these little facets of things that really, kind of combining them makes a big difference on how we heal our body emotionally, physically, spiritually, and really discovering, how to reset the cells again, whether it's an emotional component to it or physical. And so, but I also do clinical ozone treatment as well as at my clinic. And so I've added that in the last few years, and that's been very effective as well. And all the combination of the emotional treatments with the detoxification, basically, of heavy chemicals, heavy metals, things like that, that also play a part in our psychology and how we are emotionally, because those toxins can affect our mental well-being.
Yeah, it's fascinating. Really, you are inspired to this field through your own experience. And you kind of said something in your story. You talked about how with this uterine cancer, you started to wonder, ask the question, maybe there is an emotional component. So how did you, that's not a typical way for people to think about illness or health. I think things
Right.
are changing, but how did you come to that question?
Well, mainly it was because I was living under so much trauma in my life from abuse, from terrible marriage, and because of that abuse and that trauma that I was incurring and going through at that time, um, I started getting sick. And I
Mm.
thought, wow, why am I getting sick? And I worked out and I was in my best shape ever, and ate good, was real clean on my diet even then. And, and so I was really kind of just looking at, okay, is this really genetic? And even the doctors I was seeing was like, well, we don't see a genetic gene coming up for this, but it could be emotional. And so, and even talking to the doctors I was going to, the OBGYN, MDs, I luckily had found a really amazing OBGYN when I was living in the Tri-Cities area of Washington. And he was so open-minded. And so he really got me thinking on different aspects that I probably wouldn't have thought about, at that age. And some of the people that I was friends with at the gym, they were complete health nuts, and they understood, like, that whole journey of cancer and how it acts in the body. And so as I started really talking to people, it was really discovering their paths and what they did, and how it kind of helped me along my journey as well with it. And then in addition, being able to help others with their, path and that, and just kind of discovering some of the emotional components, and mine was trauma. And so and so as that kept coming up, I was like, okay, I'm going to release that trauma. I don't need to hold on to that. And so as I finally did that, I started getting better and better and better, and then became cancer-free over time with naturopathic treatments, NLP to emotional code release treatments and hypnotherapy. So it was really a great deal of combination of naturopathic and just natural treatments that I could do that was not drug related. I didn't do any chemo, no radiation, did no Western medicine whatsoever. The only thing I did with them was surgery. That was it, and all the rest was done through naturopathic treatments and hypnotherapy. And so, but I found that hypnotherapy was such I would say, a huge factor in the treatment with patients, including myself when I went through it, because there's so much stress that we go through with illness, all kinds of illness. And so whether it's, not just dealing with cancer, but being sick with viruses to, other illnesses like MS, or say, for instance, fibromyalgia, people dealing with chronic pain all the time. And I found that, as we open up that pathway to those neurological behaviors that can also be a part of some of the pain or some of the stress or, issues that we have that cause our body to go into a physical state of illness, it's really important that we focus on positive mindsets, through those times.
Right. And we know, like, stress physically affects the body.
Yes.
More stressed we get actually can affect the immune system and other functions in the body as well. So with all of this background, with naturopathic doctor background, kinesiology, hypnotherapy, NLP, what role would you say hypnotherapy plays within this kind of bigger model of holistic care?
It really plays a big part in how our body is functioning, emotionally and physically. And when we don't address, like when I have patients that are coming in and they say they want to, I'll give you an example, they want to do a smoking cessation, hypnotherapy session, right, for that. A lot of times I will find that there's emotional behaviors that are tied to it, because it's a habit.
Yeah.
Right. So a habit that they have to kick or overcome. But a lot of times there can be emotional components that go back from the time that they started, smoking, or, started a behavior like an eating disorder, for instance, that can have a lot of emotional connections to it. And we really address a lot of the emotional things first, along with, kind of discovering with, and how I do that is I discover it through kinesiology, and I figure out what blocked or trapped emotions are they holding in the organ system, and what date or time frame does it come from? Do they have inherited things that are also associated to the issue that they're coming in for? And there's just a combination of things. And then as we discover those things, we also utilize that information to go back into that subconscious to kind of retrain the brain to let go of some of those trapped and hidden emotions that are affecting their physical well-being, if that makes sense. But the
Yeah.
hypnotherapy is very effective at releasing, kind of letting go, but also healing some of that subconscious behavior and emotional, components that come along with the issue.
Right. Right.
Mhm.
So, when you look at, I'm sure, a lot of people are looking for kind of a more holistic model. Let's address multiple levels of mind, body, spirit, mental, emotional, also physical, diet, nutrition. What would you say your like philosophy or approach is with clients who come to you? Like where do you start with their process, and how do you approach seeing a new client?
Yeah, traditionally, of course, they'll fill out their intake form and we'll discuss quite a bit of, what they initially came in for, right? And sometimes I'll find that even though they're only wanting to address this one little thing, there'll be multiple things that are actually related to the problem. And so we'll discuss those details, and then I'll discover what we should start with, whether it's emotional code, release therapy, the kinesiology, the hypnotherapy. Normally, I like to try to discover what are the major components of the emotional problems that are related to the problem that they're, coming in for treatment on. And how I do that is with kinesiology. If they're not really comfortable with telling me everything, because sometimes I'll forget things too to discuss, and that's where the kinesiology really helps me to be able to uncover some things that are kind of hidden there or they're not comfortable talking about. And then I don't really necessarily have to go into details with them when I discover those problems that are there that they're holding. And then as we go through that process, of the discovery aspect of, what they're really having or what the initial problem is that they came in for. We'll do a multiple combination of treatments, with the nutritional kinesiology piece of it, because that too plays a huge part in their physical well-being and their emotional well-being. Because what I found with people that have ADHD, if they're taking in too much sugar or caffeine, then they're going to be off the charts with these weird kind of emotional behaviors that they can't control. And so that nutritional part is really, really important to the emotional aspect. And because the food or whatever they're taking in can definitely affect the psyche. And then that's where the combination of those treatments really are effective, with the clinical hypnotherapy or NLP. And I'll do a suggestibility test on them to see how suggestible their subconscious mind is to following directions or being able to let go or release things that they're holding on to emotionally. And then I'll discover and decide, okay, well, let's start with this. If you're not really a good candidate for hypnotherapy, then we'll start with the NLP and we'll start with the kinesiology and the emotional code release therapy as well. And I'll have them kind of do the three things together in a combination appointment. And so it's really fascinating how effective and fast that combo can help someone overcome the issues that they're coming in for. And really, it's really discovering, what is the actual initial problem that is the underlying issue that they start with in the first place, other than what they think they're coming in for. But we always address what they're coming in for, no matter what, even if that isn't the issue. But for them, that's their reality, right? What they really need to do. But a lot of times I'll find that there is so many people that are dealing with high stress disorders to anxiety, which can be off the chart, especially during the holiday season. They'll have lots of anxiety. And then sometimes that anxiety can be related to a trigger that they didn't deal with when they were younger.
Yeah.
you know.
Yeah.
And so there's that part of it too. So hopefully that answered the question.
Yeah. And I think you've mentioned this a couple times, is that people have like trapped emotions in their body.
Yeah.
And you're using kinesiology to kind of
Mhm.
determine or identify what those are. So
Right.
can you give kind of maybe a short example of how someone could get a trapped emotion in their body, maybe one that they're not even aware of? I know anxiety is a popular
Mhm.
topic. So is there
Yeah.
something to the effect of that you could share?
Yeah, definitely. So like a trapped emotion, for instance, there's a couple of them that I test. There's hidden emotions, then there's trapped emotions, right? So
Okay.
hidden emotions, for instance, can come from things that are genetic or they inherited, and whether it's through behavioral inheritance, whether it's through an emotional inherited code, or if it's a, thing that happened in their past life that still recur today.
Mm,
And so that's more of a hidden emotion. A trapped emotion is something that we've experienced that we haven't let go, right?
okay.
And it could be from our childhood. It could even go back in the in vitro state before birth, and they're in the mother's womb, and that child experiences whatever that mother is going through at the same time that they're pregnant with them. And so we'll find that there'll be a trapped emotion that could be related to whatever the mother was going through at that time during pregnancy in the in vitro stage, and then something that comes from the birth state as well. So even when they're being born, there could be trauma during the birth, right?
Yeah.
That they didn't know of, or maybe the mother never discussed with them.
Mhm.
And because whatever the mother is feeling and caring or having, the child is also feeling that same emotion during the womb state.
Mm,
And so, but then there's those types of trapped emotions, right? But then there can be trapped emotions that they've had childhood experiences of trauma with,
mhm,
or some other experience like grief, for instance.
mm,
And grief too can be a trapped emotion that hides, in the kidneys or around the liver. um, the spleen can hold things like fear, stress, trauma,
mhm,
anxiety is a big thing that the spleen holds. The liver can hold anger, things like, humiliation, for instance, feeling
mm,
humiliated. And sometimes kids or adults that were bullied as children will also still hold that fear-based energy of being bullied as adults.
mm.
And so there can be that trapped emotion that still kind of lies there,
Yeah,
that they've held all, their entire life.
yeah,
And so, but it's really about retraining that subconscious fear to say, well, I'm no longer that child. I'm in control of this life, right? I don't have to accept to be bullied or accept to, be pushed around, basically.
mhm,
I can be confident within myself.
mm.
And but training them on how to deal with those situations as well. And so a trapped emotion could be those types of behaviors, but there's so many different behaviors. Let me grab something real quick and I'll show you a little chart here that I use. So when I do a therapy like that, I use this chart here. And so this is an emotional code release chart. And what I do is I
Okay.
muscle test. I don't know if you can see it very good.
I can't
I
see it
muscle
very
test.
well. Yeah.
No, I'm bringing
Okay,
it up a little
there we go.
closer. Anyway, so I'll show you. I'll kind of come up a little bit
Yeah.
on it. So what I do is I muscle test all these trapped and hidden emotions that hold up in the organ system. So over here in row 1, you'll see, heart, and you'll see here that it says heart and spleen, right?
Mm-hmm.
Or back small intestine, and so then the small intestine and the heart can hold all these emotions here,
Mm-hmm.
and when that becomes trapped, what I do is I do use the kinesiology to try to discover how many years have they been holding those trapped or hidden
Yeah.
emotions. Are some of these things inherited, or are they something that has been experienced in the past life, if that makes sense.
Yeah, wow. And I've seen it in my practice as well, that people kind of have these events and it doesn't get processed, or they trap that emotion like you're talking about.
Yeah.
And that trapped emotion actually sets up a reoccurring pattern for them.
It does, yes.
Right? So like
Yes,
the bully, back to the bully scenario, the adult that gets bullied, it's like that
same.
continues somehow, right?
Yeah, yeah, and it causes anxiety, depression, PTSD triggers, those type of things when people are being bullied into adulthood as well.
Yeah.
And so they will start discovering that they'll get panic attacks or anxiety, or they'll have fear-based issues with social anxiety, for instance. Being socially in a larger environment can be a difficult situation for them. And it's only because of what not only did they experience as a child, but what they may still discover or experience into adulthood as well.
Right.
And it's really just kind of discovering, how do you deal with that now as an adult, and training them to not take it on and allow it to release and learn how to create different scenarios that they experience with it and not be triggered every time by it as well.
Yeah. And just to get specific here for our audience, is thinking about like someone
Yeah.
that was bullied, their mind might think of like, people always pick on me, or
Yeah.
maybe even I can't stand up for myself. And that's part of that reoccurring pattern. And then it's almost like their unconscious mind finds situations where this is then true, or they feel that's true.
Yeah, you bet.
Yeah.
That's so true. And that's where the trapped emotion happens, and why they hold that trapped emotion, because that's a component or part of it, and it's unfortunate because a lot of the people, they don't realize that why these keep reoccurring, and how come they keep experiencing it. And so, they'll have these same reoccurring thoughts, because of the triggers that they deal with, from their past childhood time of that experience and what they still deal with in adulthood.
Yeah.
So,
and looking at this, like the trapped emotion component, over time, it sounds like these patterns can get bigger, or it can actually start affecting the body physically or affecting different organs. Is there a way that you can kind of speak to that, like how these emotions could actually start creating illness in the body? Is there?
So like, for instance, when I find like in that row one, heart, small intestine, which are so connected as well, and when I'm discovering the trapped emotions that are there, or the hidden emotions, then I'll start discovering, oh, you've got a heart murmur, or you've got something going on with the heart, right? The heart starts kind of having a little bit of dysfunction, and it could be a component of the trapped emotion. Excuse me. I'm going to drink a little water here.
Yeah.
It could be due to the trapped emotion causing a disruption in the function of the heart. And so that's really important to kind of discover with them as you look at why are they having the medical issue in the first place, or the physical issue. But sometimes too, when I'm doing the kinesiology, I'll actually find a genetic heart problem, that is a heart murmur. It's more than just an emotional. There can be a physical thing that's coupled with it. And so, but then I'll find that trapped or hidden emotion that's in the heart still carries on with that, heart reflection. It doesn't allow the heart to really kind of function in the well, the way that it should. So, but, like the emotion of abandonment, for instance, or someone who feels like they don't receive enough love, the heart becomes really, really trapped with that emotion. So what do? They guard themselves, right? They become guarded. And then they can't open themselves up to really accepting or believing that they could receive true love, or accept and believe that somebody won't abandon them, and so the heart holds that emotion, unfortunately.
Yeah. So, perhaps you can give a little bit of background. So people who have maybe a health issue or a health challenge, and they, have the influence of Western medical, but they're also looking at using complementary and alternative methods for this bigger holistic care. What kind of advice would you give people that are kind of looking at hypnosis to help with some of their health and medical issues?
Yeah, so when I'm seeing a patient that, they're doing kind of a combination of things, whether it's Western medicine and naturopathic medicine, and they're coming in for the clinical hypnotherapy, I traditionally will do, I'll ask them a series of questions about what's working for them, what do they find is the best treatment from that they're currently doing. And, and then I have them bring their supplements and medications in with them so that we can do the kinesiology to discover basically what's working and what isn't working. Because even with supplementation, they can maybe have an allergic reaction to an herb or a plant that's in that, in that supplement, or they could be having an allergic reaction to a filler that's in the medication. And so that too can cause an emotional issue that can come up. It'll cause anxiety and high stress disorders in the body. And so we've got to basically discover that, but I'll ask them a series of questions about, the things they want to work on, first of all, and then with the hypnotherapy, we can get into the physical, not just the subconscious aspect of the body, but the emotional and spiritual part of it as well, because that's where the trapped and hidden emotions will come in that spiritual aspect, some of their belief systems, basically. Do they really believe that they have this physical or mental issue, or emotional problem that's going on? And it's interesting because I've had patients come in, for instance, that say, oh, my doctor has me on Ritalin for ADHD, or they have me on an anti-psych drug because they say that I'm depressed or some other emotional disorder, right? But then what I'll find in some cases is some of these people are actually very, what you would call hypersensitive or hyperintuitive, right? And so their kinesthetic system is always on high alert, or very sensitive to energies of others or things, right? And so hypnotherapy can help them to kind of calm that nervous system down, to retrain the brain to say, it's okay to be in this environment, or it's okay to be me and who I am without having anxiety, depression, PTSD triggers, things like that. But also discovering why it's happening in the first place, if that makes sense.
Right. You spoke to something there, and sometimes people are getting these diagnostic labels, and then they kind of take it on as their identity, like I am ADHD, and I'll even, you'll hear this out in the world around you, but it's kind of that, we talk about in hypnosis that people, any kind of I am statement that you have, your unconscious mind is taking it on as who you are. And so you're more likely to show up with that issue if you say, I am this. So do you have some kind of advice for people that are maybe hearing their own language patterns around illness? And we especially do this with illness. I am diabetic. I am, we're talking about the disease as if it's who we are. So do you have some kind of, advice about this as people are hearing and recognizing their language?
Right. Yeah. So when I'm doing the emotional code release therapy with them, because that comes up so often. And then, and a lot of those are trapped in hidden emotions, as well. That's got kind of a component of it. But when they continue labeling themselves with certain conditions or emotions, I always tell them, do you really want to wear that badge of depression? Because really that's like saying, here, I'm going to take this emotional piece of depression and I'm going to put it right here, right? Or I'm going to wear it, and one of my organs where I feel it the most, which is most likely the liver or the gallbladder, which is where depression hides, right? So often when they have that, what'll happen is, it's really about retraining the words that we tell ourselves.
Yeah.
Right. And being able to identify, because I always tell them, pay attention to how you speak to yourself on a daily basis and how you say it, right? And when you discover that you're saying, oh, I'm depressed, stop yourself for a minute and reword what you just said, and start thinking about how you think about your physical self, your emotional self, and just your energetic self.
Yeah.
And your physical, mental, emotional well-being. And so when they start doing that, and I give them little reminders, or I'll text them sometimes in, the first few sessions that we do with reminders, and just say, remember, and I'll send a kind of a powerful affirmation to say, I am positive, I am confident, you are beautiful, things like that kind of remind them to remember to always integrate into their daily behaviors or emotions that they're dealing with, to always remember to say the positive things about themselves, because we often, everybody does it, it's human nature, that we tell ourselves things that isn't really the truth,
Yeah.
And so we'll find that, we do have to be more conscious of how we speak to ourselves.
Yes.
And really it's about telling, when they come in for that therapy, I'm always reminding them, let's try to be more conscious about how you speak to yourself, right? And the words that you tell yourself.
Right.
Right.
Especially like using that example, I am depressed. How would you help clients reframe that? What would be better language, just to give people some specifics?
Instead of saying I am depressed, I always tell them, well, don't use the word depressed, use the word I am healthy.
Okay.
Mentally and emotionally, or not wearing the label or the badge of depression.
Yeah.
And I'll have them use tools.
We use it to kind of describe ourselves. And if we're feeling depressed, then we're saying like, I am depressed. But also think about that. It's kind of pushing you down. What is depressed? Pushing down. And sometimes it's actually, covering up other emotions. So what are some ways that people could describe how they're feeling without taking it on as an identity?
Right. And what I'll find too with the word depression, it'll affect their liver and it'll affect the gallbladder. And then they'll start complaining of pain along those organs on the right side of their body, below their ribs there. And as I do the kinesiology to figure out what it is it physical or is it an emotional problem? Usually it comes up depression, frustration, panic disorders, feeling of taken for granted, things like that.
Right.
And so, but what we have to do is really let them know that they can release that. And I'll have them do exercises like doing some NLP training, at home. And I'll have them do these exercises where I have them pretend that they're grabbing that emotion of depression and they're releasing and letting it go and saying, I clear, release, and let go of that label of depression and throw it out, right? Or just take their hand over that liver and gallbladder and say, I no longer identify with the emotion of depression. It is not my label. And then release, clear and release.
Right. And then what's amazing with a label that they want to carry, like you were
Yes.
saying, that
Right.
I am healthy. I am, yeah.
Yes. Really. And replacing it with those positive affirmations,
Mhm.
because as they start doing that exercise, it becomes like any habit that we get into,
Yeah.
right?
Yeah.
And then it just retrains not just the subconscious, but the conscious behavior, but it also retrains the body systems to believe in a healthier behavior, right?
Right.
Something that is going to help them create more drive, more passion, find their creativity that they have or they want to desire or create,
Yeah. Wonderful.
I mean, not everybody's creative, but they can find that somewhere, and,
Yeah. Yeah. And
right?
even, yeah, that like creative energy can be a very powerful part of healing or self-healing. Like even if
Yeah.
it's not uh actively like making music or something.
Mhm. Right. Yeah.
Yeah.
Yeah. Exactly. That's so true. Well, it's interesting because I will discover through some of the therapies that some of the people are actually artists, whether they're musicians or they're artists or they're drawing and painting or doing things, and I'll have them utilize their art also to kind of look at changing some of the, negatives into a positive and helping them overcome some of those challenges.
Yeah,
And so that's what,
that's interesting. So using art to kind of like art therapy, expressing an
Mhm.
emotion and then
Yeah.
looking at how to shift it or change it through the art itself.
Yeah,
Wow.
exactly. Yeah. It's very effective, because if you
Yeah.
think about art is beautiful, it's creative,
Mm-hmm.
and it really gives someone just a whole totally different dynamic of where they're going at, what they're at in life,
Yeah.
and how they can create and utilize their skills to better their situation, whether it's an emotional situation or they need an outlet, to kind of release stress or anxiety that they're dealing with.
Yeah.
Hmm.
Yeah. Very cool.
Yeah.
This is so fun. I loved hearing about all of your background with this. And actually, we've known each other for probably at least 15, 16 years. I
Yeah.
remember I came to you with like hives that broke out all over my body. And I remember in one session you were doing Reiki and hypnosis with me. The hives disappeared. I was totally
Yeah.
fascinated and blown away with this. So I know how effective you really are in the work that you do and so heart-centered in how you work with people. So to give our listeners here today some kind of like some experiential tool or demo, is there something that you could share
Mhm.
that people could be utilizing at home or experiencing at home to help their own system?
Yeah, definitely. So when they find themselves, repeating, I guess what you would consider negative words or, patterns that they tend to get into, I have them to always remember to stop when they say it, think about what they said, and reframe what they're saying to themselves, and really pay attention to thinking about how their, emotional words that they're putting out there, or their anger, or how they're reacting to something is affecting their body, and or even the surroundings around them, because putting out any kind of negative energy, puts that vibration out there and it affects everybody that's around them as well. And so, what I always remind them to do is to stop the word or the pattern or the behavior that they're doing, be conscious of it, right?
Hmm?
As they're doing it, and then reframe what they just did in a more positive aspect. And often that works pretty good. So it gives them a little exercise to be able to utilize in their daily life. Or I'll have them do some of the NLP work at home as well, or the releasing of trapped and hidden emotions that we discover. Because when I do the emotional code release chart, I give them a copy of that chart too that they could take home with them. And then when they do that, and I have them take this chart here, you know, and I'll write down all these things on it, and I'll write down if they have inherited genetic things that are coming up. Is it a trapped hidden emotion that goes from the age of 6 on? And there'll be different age times that'll come up on the chart as I muscle test it. There can be things back before birth in the in vitro state. And what I do is I have them take the little chart, and then I have them go home and I have them burn the paper and say, I release the trapped hidden emotions I no longer desire to carry. Right? And I let that go.
Yeah.
And sometimes they'll want to just not burn it, and they'll just remind themselves. They'll look at it periodically and go,
yeah,
oh yeah, I'm doing this. Okay, don't repeat that. Right.
But I just want to highlight that, because that, you know, act of, it's like a metaphor in getting that diagnosis or that assessment, and then you said take it home and burn it. And we actually know the language of the unconscious mind: story, imagery, metaphor, symbolism, and feelings. So I really like, it doesn't sound like, you know, I know mainstream might be thinking, oh, that may not have an impact, but your unconscious mind is actually learning from that metaphor, that process. So I just want to like highlight how that it can have a profound effect, because you're utilizing the language of unconscious mind.
Oh, definitely. Yeah, because that unconscious is so powerful, and we'll say things not even realizing that what we just said sometimes, right? And then that's really about, oh, I just said this. Let me think about that again in a different way and reframe that in a positive way, right? Instead of repeating the same negative patterns over and over and telling ourselves that they're, you know, that they have that issue, whether it's anxiety, depression, stress, frustration, whatever. And sometimes when they get frustrated over things too, I'll ask them, okay, well, what's causing you to get frustrated? Okay, how do you deal with that frustration? And I'll tell them, you know, okay, well, let's reframe that with a different way of dealing with it, so that it's not triggering other behaviors like, you know, anxiety or trauma stressors, things like that, you know. And it's so important that they remind themselves to do those daily exercises, because it really becomes a habit. And then after a while, they no longer have those triggers, or they no longer have that emotion that they used to have, right? You know, that would always cause, whether it's a physical issue or an emotional issue. And a lot of times with the, you know, going back to depression, I'll find that there's issues neurologically or chemically that are imbalanced, right? And not just the emotional part of it, but I'll find that they're lacking in, like, say, B12 or a B6 or a B1, or they could be lacking in an amino acid, for instance, that helps to control some of the central nervous system, the brain system, some of the emotional behaviors. There could be a nutritional deficiency that's part of it as well. So, and that's a big part of the treatments that I do generally, is really look at the combination between emotional and then the physical. And the nutritional.
It's so powerful. Well, thank you so much for being here and sharing your expertise and your wisdom in this field. Anything else to add to this conversation, or advice to people looking at hypnosis?
Yeah, I would definitely say to approach it with an open mind, because, you know, too many people have had this misconstrued idea about what hypnosis is, right? And often they don't understand that it's really just an integrated psychology technique that helps you to overcome, you know, whether it's emotional issues that they just haven't dealt with, you know, or it could be a physical problem like pain that they're, you know, that all the Western medicine hasn't been working for them in a way. But I, you know, and I never never dismiss that what they're doing is incorrect,
Mhm.
because I always want them to include all the aspects of everything that they're doing and really discover through the treatment, what's working for them and what isn't, and whatever isn't working for them, then we give them a better solution, to the problem.
Yeah.
But always to come in with a very open mind and not this closed mind of, thinking that, oh, hypnosis is going to control me or it's going to make me do things I don't want to do. Thing is, I have to tell people too, that's not how that quite works, because, and I told one guy one time, I said, would you go over and hug that lady over there that you don't know? If I were to tell your subconscious to go do that, would you do that consciously? And he said, oh no, I would never do that. And I'd say, well, then I can't control you, can I? And so it's just kind of like those kind of aspects that people don't realize, that you're not going to do what you're not comfortable with subconsciously or consciously. And if you even sometimes they'll have what you would consider a resistance, for instance, maybe they're resisting letting go of something, right?
Mhm.
And then you've got to reframe it differently so that they're not resisting what they're holding on to, right? Or old belief, basically. But really, I just kind of educate them on what hypnosis is used for clinically, and the difference between the clinical hypnotherapy and how therapeutic it is compared to what they may have seen at some trade show. Right.
Oh, right.
That is just, used for comedy or what, right? And that's not it. That's not how it works. Yeah. It's really, it's just letting them know about the integrated psychology aspect of it and how effective it can be to help them overcome the challenges or trapped in hidden emotions, or issues that they're coming in for.
Wonderful. So if people want to connect with you or find out more information about your work, where is a good place for them to go? Where can they find your information?
Yeah, so they can find my website at www.nw, N as in Nancy, W as in Washington, and hypnosis. So it's nwhypnosis.net. Or they can call me at 360-991-2619, and they can text me at that number as well.
Excellent.
Yeah.
Thank you so much, Dr. Sherrie, for being with us here today. And we'll have to do another interview about, I know there's a deeper conversation about your journey with cancer and utilizing natural health methods as well. So
definitely. Yes,
so
thank you. Well, thank you for having me on today. I really appreciate it.
Thank you. All right, we'll see you next time. Bye, everybody out there.